A rare monkeypox outbreak has been detected in several Western countries including Portugal, Spain, England, Australia, Canada, and America. The big question is, how does the disease affect children and what are we supposed to do to prevent our kids getting sick? Stay with us to get the answers. Pox means eruptions that are pus-filled and can leave pockmarks. Poxviruses are a diverse group of large, oval-shaped, double-stranded DNA viruses that are present globally, and have been isolated from birds, insects, reptiles, and mammals. As a general rule, poxvirus infections typically cause skin lesions including skin nodules, or widespread rash. At present, ORF, molluscum contagiosum, and monkeypox are the leading causes of poxvirus infections worldwide. Monkeypox is a zoonotic infection that results in a smallpox-like disease in humans. Monkeypox virus was so named, because it was first identified among colonies of laboratory monkeys. But monkeys aren't major carriers. In fact, the virus mainly circulates in rodents such as squirrels, pouched rats, and dormice. So, rodent pox seems to be a better name for the virus. Monkeypox mainly appears in rainforests of Central and Western Africa. But in recent weeks, America, England, and some European countries have been reporting monkeypox cases as well. The clinical presentations of monkeypox are similar to, but milder than the smallpox. Fortunately, large studies in Africa have revealed that majority of monkeypox cases are asymptomatic. In symptomatic patients, clinical course of the illness can be divided in two periods: the invasion period, and the skin eruption. Following an incubation period of 10 to 14 days, the patients typically begin to exhibit nonspecific symptoms such as fever, chills, tiredness, headache, muscle aches, and enlarged lymph nodes, also known as lymphadenopathy. It's noteworthy to know that lymphadenopathy is the only useful feature that helps physicians differentiate monkeypox from similar diseases such as chickenpox, smallpox, and measles. A few days later, skin eruption begins to develop. At this stage, flat red spots, or maculopapular rash appear first. Then the rash turns into bumps called blisters. Then the blisters fill with thick, opaque pus forming tender pustules. The pustules finally become crust and scab. Both animal-to-human and human-to-human transmission are reported. Animal-to-human or zoonotic transmission occurs by bite or scratch, and direct contact with the blood, bodily fluids, skin or mucosal lesions of infected animals. In human-to-human transmission, the virus typically spreads from close contact with infected persons through respiratory secretions, direct contact with skin lesions, or bodily fluids, or even indirect contact with contaminated clothing and bedding. Uncomplicated cases of monkeypox are usually self-limited with the symptoms lasting from 2 to 4 weeks. Severe disease can cause dangerous and even life-threatening conditions such as secondary bacterial infections, pneumonia, corneal ulcers and blindness, blood infection, and encephalitis, that is a medical term for infection of brain tissue. Studies demonstrate that severe cases occur more commonly among children. Between 1970 and 1984, out of 247 cases in Congo, 98% of severe cases, and 100% of fatalities occurred among children. So, it's crucial to learn effective ways to protect our children against the disease as much as possible. Here are some effective ways to prevent viral transmission. Avoid any contacts with animals that could carry the virus. Avoid contact with any materials, such as bedding that has been in contact with a sick animal. Isolate patients suspected of having monkeypox in a private room. Good news is that, unlike many viral infections like flu and COVID-19, monkeypox is minimally infectious during the incubation period. This means that asymptomatic transmission is very, very rare and almost never happens. So, we can simply prevent our children getting sick by quarantining affected patients as soon as they become symptomatic. Practice good hand hygiene after contact with infected animals or humans. For example, wash your hands with soap and water, or use an alcohol-based hand sanitizer. Hopefully, smallpox vaccine can prevent monkeypox infection effectively. Besides, like COVID-19 vaccines, smallpox vaccination may ameliorate the clinical manifestations of monkeypox. Historical studies have shown that smallpox vaccination is about 85% protective against monkeypox as well. However, thanks to the eradication of smallpox in 1980, routine vaccination against smallpox is no longer implemented. This could be an explanation for monkeypox outbreaks after the discontinuation of smallpox vaccination program. Thanks for your watching. Please let me know the pediatric issues you are willing to learn. Write them in the comments for me. Good luck.